Hi, I'm Ruth Soulsby and I'm a consultant colorectal surgeon at New Cross Hospital. So most days what I'll do is I'll go and see all the patients that belong to me in the hospital, check they're all right. Sometimes I'll go to outpatients, which is a bit like going to see your family doctor or your practice nurse, and then I'll do operating, and sometimes something called endoscopy, which is where you look inside the bowel. I'm a colorectal surgeon, which means that I mainly deal with abdomen, so tummies and bottoms, so tums and bums. What you need to become a surgeon nowadays is you need your A-levels. And having said that, I was not a very good primary school child. I was a very late developer, so none of my primary school teachers would ever have thought that I would become a consultant surgeon, but I proved them all wrong. You need A-levels, then you do 5 years at medical school, you do your 2 years after you become a doctor, and then you go into core training for 2 years, and then further training for 5 years. And at that point you can decide what kind of surgeon that you want to be, because there's plenty of different types to choose. You need to be hardworking, you need to kind of enjoy getting on with people, because your patients are a big part of your job. But also because you're a surgeon, you need to have reasonable skills with your hands. And nowadays, with a lot of keyhole surgery and robotic surgery, actually doing a little bit of PlayStation, etc., is something that does help the aspiring surgeon. When you become a surgeon, you can do lots of different things. You can do different kinds of surgery. So you could be a children's surgeon, or you could do brain surgery or abdominal surgery. There's lots of different specialties. But you can also go beyond that. You can become an international player in the surgical arena. So you can do things more locally in your hospital. So I do different roles in the hospital and have done different roles in the past, exploring different things on safety in the hospital. The pay is good and the satisfaction is excellent. It's a very hard working job, but it's amazing to see patients come in and they're very sick, and you can sometimes make them so much better with an operation. I see some of my patients for years on end when they come back after major cancer surgery, and that's a very rewarding thing to see these people getting better and going about their lives.